Measuring how well our media campaigns are working is key to GMC's success. Our most in-depth study to date is here in Tana River, in the east of Kenya, a region so isolated few agencies work here. But its remoteness is also an advantage. With so few external factors influencing the community, we can really measure whether religious leaders speaking out against FGM in the media is changing attitudes. Over 90% of girls here undergo type 3 FGM, the most severe form where the clitoris and the labia are removed and what's left is sewn up. But things seem to be changing. The impact measurement team from Nairobi University speak the local languages, but they come from outside the region to ensure objectivity. Since 2017, they've made this long journey 4 times, through rain and through shine.
The important thing about the impact studies is that they're being evaluated professionally by people who know what they're doing, people who are from the countries involved because they understand the nuance behind what's happening.
The team members are from FGM practicing communities and are trained in public health research.
The evaluations are thorough and really are going in the right direction to find out what actually works, and there's plenty of evidence already that things are working.
The team travels to the remotest villages, going from door to door conducting surveys about whether media messaging is affecting people's attitudes to FGM. Importantly, it's always the same team that keeps coming back here. Being consistent is how they've gained the community's trust, and this is crucial to ensuring that their data is accurate. The team also goes to the marketplace, questioning up to 200 people over the course of several days. When the process started 3 years ago, it was far from easy.
The first time we were collecting data, it was a bit difficult because people were not very free, they were not very comfortable, that fear of where the information is going to be taken. But now, we're going back, we have gained their trust and they are honest with us now. They tell us themselves, they trust us now.
Results have been very promising. In just 3 years, awareness of the End FGM media campaign has risen from 17 to 60%.
After the interventions, we saw there's a change. After 6 months, when we went back to collect data, people were more aware of what FGM was doing to their body, doing to their women. For example, 90% in the post-intervention feel that FGM type 3 is no longer necessary, compared to 65% in the pre-intervention stage. There's also a significant increase in knowledge of the dangers and the harmful effects of FGM. The level of knowledge was at 65% during pre-intervention, and it has risen to 83% post-intervention. So this increase in knowledge is definitely as a result of the media campaigns on the ground. People are being educated more and more in the local FM radios. 60% are listening to radio through their mobile phones. They are very cheap and affordable to the community, and you can access the local FM without any internet connection. Before, there was no religious leader talking about FGM.
Na Waswahili wanatuambia mazoea yana tabu.
There's no members of the community who are talking about FGM. There was stigma because FGM is a very sensitive topic and it cannot be discussed publicly, and it is believed to be women's issue. But now, people are now freely talking about FGM. Religious leaders are talking about FGM. So that is a great change. It has really surprised me, and it has also surprised the community members themselves, realizing that this practice has no benefit to them.
To confirm these shifts in attitudes, Sadia and her team conduct focus groups with participants ranging from the very elderly to teenagers like these.
Baba Kikinyera koda baba. Doge milalo.
The people of Tana River respect the views of their religious leaders and their chiefs, so these key influencers are interviewed to see what changes they are noticing.
Kuna mabadiliko kwa sababu zamani watu walikuwa na wakati wa likizo unasikia kila sehemu watoto wamekeketwa. Huyu msichana alikuwa anaitwa Sadia Hussein, na akaendelea hivyo kupigana hivyo vita, na alipoona ya kwamba yeye peke yake hawezi.
Sadia Hussein has become a household name in Kenya. Since graduating from our media academy in 2017, she's reached millions through social media, radio and her TV presence. Her focus has been to get religious leaders speaking out on the media.
I've seen the fruits of engaging religious leaders.
And their message is reaching all parts of society.
Some of the circumcisers has denounced the practice. I talked to 3 circumcisers who have taken an oath not to cut any girl.
This circumciser is 109 years old and gave up the practice after 80 years cutting girls. She says it was hearing religious leaders on the radio that finally convinced her to stop. Another informant is a gynecologist in the local hospital.
2 years down the line now there's change. Yeah, the number of FGM, but the type of FGM also, they have changed it. Some people have started to withdraw from the practices.
From your estimate, you can say they have totally abandoned it.
20% they say.
20% for abandonment, and 80% have
still,
shifted.
Yes, to change, In 1-2 years, not even 5 years, I'm sure it will completely be stopped. Yeah.
GMC approach is working. It is working well.
I would endorse the Global Media Campaign's methodology and its thorough evaluation 100%. I really think that this is a very, very promising way forward.
With sustained media messaging, we will be able to achieve our abandonment goal.